Good. Hey, what's going on, everybody? This is Dr. Schilling from Scotia Health, bringing this week's Wednesday Wellness Minutes. And if you haven't noticed, it's absolutely beautiful outside. So that's why Elle and I came out here to venture in the great outdoors and share with you some tips on your health and how being too sterile can affect you in a negative way. So first of all, obviously you saw from our post earlier about whether is being too clean not good for you. And in fact, it is not a good thing for you. So we're going to talk about some important things relating to your health and what you might be doing to try and protect yourself from the bugs, if you will, that are potentially, and if you don't want potentially, actually definitely undermining your health and the health of your children or people you love. So yes, the answer to your question is yes, you can be too sterile. Sterility starts from early ages. Hospital births, hyper-sterile environments where they have washed everything down. You know, they're completely paranoid about bugs. You know, you get things developing like MRSA, which is methicillin-resistant Staphylococcus aureus, or C. diff and things like that, which used to be hospital-based infections, but now are actually in the environment and everywhere. So don't worry about going to the hospital to get MRSA. You can get it from your neighbor. No, I'm kidding. You don't get it from anybody. But, so let's talk about some things that you might be doing on a daily basis to undermine your health and your vitality. Hand sanitizers are probably one of the worst things you could possibly do for yourself. Now, I have seen comments from people that are well-trained medical physicians, and you have to understand how people are indoctrinated into the mentality. They have been taught the germ theory, so they believe that the outside germs, you know, that they're actually outside of you, not just in you, and that they're actually foreign invaders and they're opportunistic organisms. They're going to take over your body and attack you and kill you, right? It couldn't be further from the truth. If you understand that, if you carbon date this planet, it's about 4.8 billion years old, and human beings have been around for about 10,000 years or so. I suppose that's when we transitioned from Neanderthals to human beings. The chance of you getting exposed to something new, something novel, we'll just use the term novel because they like to use that with the coronavirus now. But novel, like there's nothing new. Like things are not coming in from outer space that we know of. If there's something on this planet, you've been exposed to it. The world is a global economy now. So the bugs that used to be in Wuhan, China are now in Minnesota and vice versa. You're not getting exposed to things that are new. So you have to take a step back from the information that's being fed on the news media because it's sensationalized and it's helping you stay glued to the TV, feeding you all this information based on what they want you to think about. So that you start thinking about how you should be afraid of your own life, afraid of COVID, and afraid of everything else, afraid of getting sneezed on, things like that. If you're worried about bugs, like the hand dryers in the bathrooms that blow those, you know, the turbo air, those are the worst things possible for spreading things if you want to spread things, right? The best thing is a paper towel, as a matter of fact. They've done studies on this. But getting back to our comments before, hand sanitizers are killing off the microbes on the outside of your body. You have about 50 trillion, it's somewhere between 7 and 50, so who really cares, right? It's a trillion, it's a big number. You have trillions of bugs on your body and in your body. In fact, you have 10 times as many bugs on your body and in your body than you have cells of your body. So if you had, for example, 50 trillion cells in your body, you have 500 trillion bacteria, molds, funguses, parasites, and viruses inside and outside of your body. If you did not have them, you would not survive. They make up the majority of your immune system. So when you think about that, it's not about being afraid of the bugs. Okay, we'll talk about more of that in a minute, but bleach. Bleach is, of course, used pretty widely in a lot of different environments. It's, you know, said to kill 99.99% of everything, right? Even the old bleaches, it says, kills the coronavirus, right? So when you think about your environment and you think about the potential for you to be exposed, so you got a nice big truck coming by, so you have to forgive us on that one. But staying away from these hand sanitizers and things like that, they're not going to protect you. They're going to make your health worse because they're going to limit you from being exposed to microbiome, strengthening your microbiome and boosting your immunity. Okay? Dirt. Get your hands in the dirt. Do not avoid dirt. Get in the sun. Vitamin D and the sun exposure, which is feeling fantastic right now, is one of the best things you could possibly do for yourself. I encourage you to get out there every day. You know, go out for lunch, take a 10-minute walk. It doesn't matter what you do, get some exposure, especially while it's not winter in Minnesota. Frequently showering. It wasn't until probably the French or some other culture that said, you know, it's just not proper to be dirty. We started showering every day. People never showered every day. First of all, water was scarce. Running water, certainly you had to bring a bucket in from outside and bathe yourself with soap and water and stuff like that. It wasn't until we had indoor plumbing that people started bathing every day. And then, of course, people are freaking out about BO and stuff like that. Like, you have natural pheromones. It's healthy for your body to have oils on it. Washing your body off every day and cleaning yourself in an obsessive manner is not healthy for you. It's limiting your health. What else is next? Hand washing. Okay, like, look, if you happen to change a baby's diaper and you have poop on your hand, you should wash your hands with something strong, right? You don't want to go dipping your fingers in some feces and getting that exposed and stuff like that. But other than that, basic hand washing is completely effective at cleaning your body off and keeping you, quote unquote, safe. Cesarean births, which are widely used in this day and age, are dramatically negatively affecting the health and the vitality of the children being born these days. The vaginal canal is like your first indoctrination into the external world, and it's the most beneficial thing you could possibly do for a child. If you, for some reason, have to have an emergency C-section, or you have to, you're not wanting a cesarean, or you want a cesarean birth because you do not want to go through the pains of childbirth, whatever it is, make sure that you have someone swab your vaginal opening, and then you blot the eyes and the mouth and opening of the child, because that's what they get exposed to when they come down the vaginal canal. It's absolutely critical for setting up the immune system for the child. The next step is breastfeed as soon as possible, because the beneficial medium chain fatty acids and things like that in the breast milk are going to impart immunity. There's a lot of immunoglobulins in there, a lot of good stuff we don't have time to go into now, but breastfeeding is probably the most, they always say breast is best. Breast is best, back is best. Keep your kids sleeping on their back. Don't let them, snuggle their face down in blankets and stuff like that. But different example, okay? Probiotics. Probiotics are definitely beneficial for boosting your immunity. If for some reason you have an adverse reaction in your gut from taking a probiotic, it's probably because you have some type of small intestine bacterial overgrowth or something like that, and you should consider that you might need to back off the probiotic before you continue on it and get some help with that, okay? Get exposure. Get it often and get it early in life. Get your kids playing in the dirt. There are beneficial microbes in the dirt, bacteria in the dirt. Those are going to be your immune system. They joke about, kids eating their boogers, right? Kids should eat their boogers, right? Recycle the stuff. Get it in your system. Get it down in your gut. Your body has mucous membranes. It's there to protect you from outside invaders per se, but it's help about building your immune system. So I'm just going to run through some simple ideas about how a hypersterile environment can affect you in a negative way. Not help you, but affect you in a negative way. Your mental health. Having a hypersterile environment can affect your internal environment, which can affect your level of anxiety and or depression. Okay? Your gut microbiome is critical as far as creating the psychobiotics in your gut that are going to feed your brain. Serotonin is mostly made in your gut. It's used mostly in your brain, but people don't understand it's mostly made in your gut. I think 400% more in your gut than in your brain. So if you have decreased serotonin in your brain, you're taking a selective serotonin reuptake inhibitor, and it's called an SSRI, you might have an upset gut. Okay? Drinking water. Lord knows people are peeing out birth control. There's chlorine in the water. There's fluorine in the water for your teeth and stuff like that. And there's a lot of antibiotics in the water. So also know that cattle and everything like that are peeing out more antibiotics, because the biggest use of antibiotics these days is our cattle, our livestock, peeing out, getting in the groundwater, getting into our water supply, and then getting in your body. So we are in a hyper usage of antibiotics. They don't test you for what strain you need. They just simply say, here's a Z-Pack, go take it home, or whatever brand they use. They just say, well, this is what we use for this, and you're going to take it, because that's our protocol. So understand that medications like antibiotics are going to adversely affect you. Now, if you are dying, if you have some type of sepsis in your gut or something like that, and they can test you and they can tell you which strain it is, and you can take a specific antibiotic for the imbalance you have, obviously save your life, do what you got to do, but you need some help recovering your gut from after that. All right, what else? Leaky gut. Leaky gut means leaky brain, okay? Leaky gut means leaky skin. Think of your gut wall like a piece of Swiss cheese. You eat proteins in your gut, and they're supposed to stay in your gut and get processed there, but they leak into your bloodstream, and then you get things called lipopolysaccharides or LPSs. They go up into your brain. You get leaky brain. You got a blood-brain barrier. Stuff gets through there. That's going to affect your mental health. So you might not think putting hand sanitizer on your body is going to affect your brain or your gut, but it absolutely does. Because then who knows how long before you people are like, oh, unless you spray Lysol in your mouth or unless you eat hand sanitizer, it's not going to affect your gut. That's absolutely asinine. When you change the microbiome on the outside of your body, you're changing it on the inside of your body. Do not pass go. Do not collect $200 if you're playing Monopoly. You're going to affect your insider microbiome. You have to understand that, because it's not just the bugs that are living inside your body, but they're living on the outside as well. And they interchange through your mucous membranes and things like that. If you have things like SIBO, gas and bloating is a good sign of that. So that might be an incompetent ileocecal valve. You might have H. pylori in your stomach, too many bacteria in your small intestine. They're supposed to be in your large intestine, things like that. It's well known that your microbiome is determining your obesity, and obesity is one of the comorbidities or the common conditions that your body has that affect your health. So if you're obese and you are type 2 diabetic or type 1 diabetic, type 1 diabetics are typically not obese, just so you know, because it's your body's catabolizing, but type 2 diabetics and things like that, insulin resistance, that's a big risk factor for things even like, we'll just throw COVID in there because that's a big comorbidity, okay? What else? Food sensitivities. Food sensitivities are well known to be a byproduct of hypersterile environments as children. I personally took corticosteroids, inhaled corticosteroids for over 30 years. I can assure you that trashed my immune system, and I'm still in the process of recovering it. So you can't take something without an effect. There is an effect. There will be an effect from a cause. You've created a cause in your body, you're going to create an effect as a result. Hypersterile environments, asthma and allergies. It's well known. There's well-known documentation from peer-reviewed research to understand that your internal environment, your external environment, your microbiome is being adversely affected by hand sanitizers and bleach and things like that, which is affecting your insides. If you affect the outside, you affect the inside, right? Just think about the inhaled things from Lysol sprays and stuff like that. The reason you're afraid of bugs is because marketers have told you to be afraid of bugs, right? And that medical professionals have bought into the germ theory, like bugs are bad, bugs kill you, things like that. Bugs don't kill you. Most of them save your life. In fact, you need viruses every time your body's in a cytotoxic healing reaction in order to try and save you, okay? And the people that can't clear the debris and the garbage from a cytotoxic cell reaction with viruses are the ones that die. And they have comorbidities like lung conditions, not from smoking, but like emphysema and asthma and type 2 diabetes and things like that. They cannot heal because they don't have the energy to heal. So it's not COVID-19 that kills you, it's a lot of other things. So just get rid of the germ theory. The bugs are not the problem, okay? Bacteria and viruses evolve. They don't just stay static. They adapt to environment. That's why there are things like MRSA and things like C. diff and things like that are other antibiotic-resistant bacteria. These bugs do not stay like, they're not just sitting there and just saying, well, I'm just not going to adapt to my environment. They've been around way longer than humans as far as we know from scientific studies. So your bugs will adapt, they'll evolve. And if you think that a vaccine is going to save you, you're sadly mistaken, because vaccination does not equal immunity, okay? It just doesn't work that way, because people get illnesses after they've been vaccinated. People get the flu vaccine, they get sick anyway, as a basic example. You may have watched the clip of a gentleman by the name of Dr. Erickson. He's a urgent care physician out in California. He's talking about how the science does not back up the reaction that's happened with COVID, and he and one of his fellow doctors there have they've been disowned by the medical community. They've been chastised, they've been ostracized, and now basically they're being labeled as profiteers. They're saying, well, they're just bringing this up because they want to profit from their urgent care center. It's absolutely asinine. You have to take into consideration what these people are propagating as far as information and who they're trying to, everybody's talking about COVID and how it's going to kill you, and then these two guys come online and they happen to be medical professionals, and they're the only ones that have finally stuck their neck out there to say, what you're being fed is a bunch of crap. The science does not support it, the research doesn't support it, the numbers of people dying are not supporting it, so you have to understand where you're getting your information. You have to do more homework than CNN, CBC, PBS, Fox, whatever it is. Do not believe it for a second. You're being told a story, so you believe it, so you're buying a certain thing, okay? I'll get off that for a second here. Anyway, coming back to it, early exposure is the best. Get your kids exposed to the dirt. Let them play in the dirt. Let them eat their boogers. Let them do whatever they got to do to get exposed to it so that they stay healthy. Make sure as best you can to do vaginal birth. If you can't do that, swab the vaginal opening, get it on the eyes and the mucous membranes and stuff like that. I can assure you that's going to be way better than some vitamin K shot or some other strep B shot or some other antibiotic they give you. The bugs are not the problem. So rather than raging on about this, because I'm a little bit passionate about it, just understand that no stress equals no sickness, okay? If there is no stress in the environment, there's no stress in the family, there's no stress while the baby's in the mother's womb, and the mother is calm and peaceful and having the birth process, you're going to have a healthy kid. Have a traditional childbirth. If you understand that if your woman passes out, if she lost consciousness, her body would still birth the child. It's been going on for 10,000 years, if not more, okay? I'm sure Neanderthals had some type of mammalian birth anyway, so it's probably going on for 100,000 years, who knows? But keep your stress low, keep your immunity strong. Focus on maximizing your internal environment. Stop focusing on the external environment because that's just an attempt to control you, okay? No stress equals no sickness. Optimize your internal environment. Stop hyper sanitizing things. Stop wiping down your shopping cart before you go shopping. Stop worrying about people that are sneezing, coughing, and carrying on next to you in the plane. Look, I work in healthcare. Every one of my team members work in healthcare. People across the country and across the world work in healthcare. If we were literally adopting and adhering to the germ theory, none of us would be healthy because we're constantly being exposed to new bugs. So step away from the fervor pitch of all this misinformation and the scared, the fear mongering of the germ theory and say, people work in healthcare every day and they're not sick. The only time I'm sick is when I allow some type of stress to get invested in me. And when I'm talking about sick, I'm talking about a healing reaction, which means I get a runny nose, I get a fever, I get a headache, I get some type of bowel disruption, something like that. It's only because I haven't handled my stress. So if I can handle my stress, I'm going to be healthy. Plain and simple. Okay? Get your kids exposed to bugs. Let them play in the dirt. I tell Sophia every time something falls on the floor, pick that up and eat it. And it's not because I'm afraid of scarcity and not afraid of because she's going to waste it. I'm afraid that not afraid of anything actually. I want her gut to get exposed to it. I want her body to be exposed to it so she can get stronger. Okay? She's got nooks, that she sucks on because she loves her thumb still. So if it falls on the floor, pick it up, throw it back in her mouth. It's only going to benefit her. Okay? So if you can take a step back from all the fear mongering and say, okay, these bugs have been around for way longer than any of us, and they'll still be here as long as we're here and long after we're here. Okay? At some point, this earth could rid us of the human race if we're not careful. We don't know what's going to happen, but I can assure you that these bugs will be more resilient than we are. They're more adaptable than we are. But basic premise is keep your stress low, and you'll be strong and healthy. Okay? So we'll sign off for now. Hopefully it wasn't too much of a rant for you, but sometimes you just got to go on a rant. So we appreciate you guys tuning in. Share this with your friends and family. Get the conversation going about the health of our environment and health of our bodies and decreasing our stress and not buying into the fear mongering. Okay? We look forward to seeing you next week for the Wednesday Wellness Minutes. Tune in this Friday for our Friday Q&A. Bring your questions. Email them to us, info@sequoiahealth.com or 651-728-1390, I think is a cell phone. If not, just DM us on Facebook here. We'll get you the information and we'll go from there. All right, guys? Have a great night. Enjoy the sunshine. Get out. Eat some dirt. Just kidding. Play in the dirt. And then have fun. Enjoy life. All right? Take care. Bye-bye.